Do you have a bunion and think your only option is surgery? Make sure you watch this video. I've got a great top tip for how you can avoid surgery if you wish. So in this video, I'm going to take you through the two main options that you do have for a bunion. One is surgery and the other one is conservative management, which is what we sort of work, the space we work in, and what we see we do lots and lots of work in this area. In fact, we see over 200 bunions a week, and the actual treatment option for that is called foot mobilization. Now, foot mobilization is a gentle hands-on technique where we work on actually improving the alignment of your feet and give you a more functional foot long term. And the upside is that we improve your ankle and foot alignment, and then also start to strengthen the muscles through those tissues. And then we can actually, in many cases, start to straighten up the toe as well, which therefore helps your bunion. Whereas the surgical intervention obviously is far more involved, where they tend to go in and they have to reset a whole range of different things. So they shave off the bone and they break through those areas. And surgeons do a wonderful job for what they do, but it's really, really important to remember that surgery is trauma to your foot. In fact, a surgeon once told me that. As a result, the recovery is fairly significant. In fact, it can be 6 to 12 months before the swelling stops. And surgeons don't mislead people about this. In fact, most of the good surgeons in this area will often say stuff like, come back and see me when you can't walk. So they tend to put treatment off until as long as they possibly can. So the upside of the surgery is that they can make everything look really quite nice because they can shave the bone off. The one thing we can't do is take off the bone. But the great thing is that we can usually cater for everything else associated with the bunion. I guess the key is that if you want to consider conservative management approach, the important thing is that you consider treatment early. What I would say is don't wait until your bunion hurts. Don't wait until it gets so big that you can't do anything about it. The further it deviates, the less we can help you from a conservative management approach. And you might feel that surgery is a great option for you. But if you don't want to go through surgery, and keep in mind surgery will be a significant amount of discomfort, it will be very involved, and the recovery is very significant, as in months, if not sort of 12 to 18 months. Whereas we can keep your foot functional for the rest of your life through some gentle hands-on technique. You can keep being active throughout the process. So needless to say, it's not that one's better than the other. It's just that they're very, very different, and it depends on what your needs are. So we get a number of people who have left it too long and they're very disappointed that they have to consider the surgical option. Not to mention the surgical option is quite expensive too. So it's definitely something to take into account. If you'd like to know more, or you feel we could offer you some more help, go to sydneyfootsolutions.com.au. We've got lots of helpful tips there. We also have a 65% off initial bunion assessment offer, where you can get your bunion checked out if you're a new patient. Thank you very much.